welcome to your Module 7 Patient Comfort quick tutorial. This is for your WWCC Nursing Assistant course and RST 1510. This is a very large module, so please start taking notes, making sure that you are practicing your skills and feeling comfortable with them. You do not need to bring those papers to lab that they give you. If you want to print out those as resources so you can start memorizing the skills and the steps along with the skills, go ahead and do so. But there's a skills packet under course information that you will bring to lab, and that's the skills we're going to use. It's the same skills if you for your boards, your certification test. Okay. So here's the submodules. As you can tell, there's lots and lots of little ones here. Observing patients, handling bed linens, making beds, peri-care, hand and foot care, hair care, oral care, dressing and undressing, bathing, eyeglasses and hearing aids, and AM, PM, and pain management. So I'm not going to go into with every step. So you have to go to Health Center 21 and go through each module or submodule and subunit, and making sure that you understand what is required for each one of these. There's lots of little steps, okay? So starting off with observing patients, make sure that you are taking note of any changes that do occur with your patient or resident or client, depending on where you work in the healthcare field. Those little changes, the nurse's aide is with the patient more than the nurse, so you guys notice the little things, like even the way they bite their jaw different or something like that. Notify the nurse as soon as you can. Okay, don't pass it on. Don't wait till the end of the shift, because sometimes it's forgotten and you think someone else is going to do it. So make sure you do report changes to your nurse. Observing patients also includes the personal hygiene. Daily procedures is included into that hygiene. That's oral care, bathing, and stuff like that. Encourage them to do as much as possible. Also the environment, making sure their environment is safe, and making sure that there is a clean area, that there's appropriate lighting, there's no messes everywhere, they don't have bugs in their room. That is observing patients and part of keeping them healthy. Communication. When you are communicating with them, it's also another part of just making sure that their health care is taken care of. Make sure you're respectful, you're clear with your information, you're concise, you're courteous. Like I said, you treat patients like you want to be treated. General observation, when you are getting them ready for their AM routines, PM routines, maybe just toileting them, doing peri-care, you are doing a general observation all the time, because you are the eyes and ears of this operation, okay? You are going to be an expert at multitasking. So if someone's maybe sitting on the toilet and having a bowel movement, maybe that time you're cleaning up the room, making their environment safe, maybe you're picking out clothes. You are going to be, like I said, just so proficient at multitasking. It's going to be unbelievable. Use the time wisely so you're not having to stay over on shifts or pass a lot of stuff on to the next shift. Confirm what you see with the patients. For instance, if you see them grimacing, maybe you'll want to ask, it appears that you're in pain today. Can you explain what's going on? I'm reporting that to the nurse. Maybe that grimace is just because their sock is bunched up. Because you're observing it and you're paying attention to what's going on and you've confirmed it with the patient, you notice it's not pain, it's just a sock bunched up. Maybe you notice their intake has declined. It's because they had corn on their tray for the last 3 days and they don't like corn. So you're making general observations with that. Two parts of observation is objective and subjective. Please know these. This is going to be asked of you throughout this class and then on in nursing classes and healthcare classes that you are taking. Okay? Objective, that means you observed it. You can measure, you can see it. It's concrete. It's not any guessing game. So if I take a temperature and the thermometer reads 98.8, it's concrete measurement. So I can chart a 98.8. You use all your senses with that objective observations. Subjective, I like to remember it as said. It's something that your resident said, your patient said to you. So they can report, well, last night I didn't sleep very well. It's something they said. However, concrete information is you 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 saw, you noted that they did sleep from 8 to 10 without any movement in their bed. So you can see the difference between subjective and objective. They said that they're dissatisfied with something, okay? And with that, they were grimacing, okay? So when they're grimacing, that's concrete. You saw that, okay? So that's the differences, okay? So let's move on to the skills that they're going to start covering in this unit. The first one's going to be bed making. First, I want to point out when you are bed making that you need to always watch your body mechanics and make sure if you bring your bed up to your hip level or your belly button level that you're putting it back down when you leave the room. Other things as make sure the bed is flat. You don't want the head of the bed elevated when you're trying to make the bed. You always want to gather your supplies before going in the room. You're using your standard precautions when you're in there, and that's gloves, things like that, making sure that your clothing is not coming in contact with soiled linens, clean linens, things like that. Remember, most facilities have large yellow hampers, usually located in the hallways or in a dirty or soiled linen room. So make sure that those hampers never ever go inside the rooms. Sometimes, depending on where you work, they might have small hampers in the rooms. Those are for smaller items like shirts or jeans. So if you do have to take soiled linen out, remember the bagging process. If they're in isolation, you double bag. You never shake any soiled linens or clean linens. They do go directly into a hamper or bag. Remember to roll the linens into a nice package so all the dirty germs, all the stuff that has occurred on those linens stay in a closed environment. It's just good infection control practices, and it also makes sure that you stay clean and you don't bring any of that germs home on your clothes. Also for clean linens, even if you thought Mrs. Jones needed a bed change and Sally, the other nurse's aide, changed the linens already. Once those linens are in the room, you cannot take them out. Okay? And at the end of making all the beds, make sure you understand how to do mitered corners. It's a technique that we secure the sheets and comforters to the actual mattress. Up here, I did do a picture of it. This is the mattress. You put the sheet on. You pull the bottom of the sheet up. See number 2 up. You tuck that little triangle portion underneath the mattress. See, it's in this in C. And then drop that down. It should look really nice and tidy. And then you tuck the rest of that linen in. Okay? Know your bed types, because a lot of times we do use that medical terminology. So the nurse might say, go close that bed for, you need to know what to do. And the closed bed just means it's made and it's prepared. No one is assigned to that bed, and it's ready for a new patient when assignments come around. An unoccupied bed means a patient is assigned to that bed. It's just the patient is not in the bed. An open bed is a fan folded from the sheets and everything all the way down to the bottom of the bed. This welcomes the new patient. That is used very frequently. So if I said, can you please go open the bed for a new admission, you fan fold those sheets all the way down, and it is an open bed now ready for that new patient. An occupied bed, of course, that's a patient in the bed. A surgical bed, you're not going to see this very often, and some surgical sites don't even require the surgical bed. They use the open bed technique, but they would fan fold it to the left or right, depending on where what side the gurney is going to be on, and then allows the patient to be pulled right over, and the blanket's right on top of them. The next skill that they're going to go over in Health Center 21 is your perineal care. That is for female peri-care. You need to always make sure you're wiping front to back. That with all peri-care that you're showing respect, dignity, and they're embarrassed just like you are, especially when you're first becoming a CNA and working out in the field. You're not as comfortable with it. Remember to use the correct terms. They might not, they shake it off and they might use some incorrect terminology, and you might get comfortable, but however, always use the correct terms with them. There's a picture right there of the female anatomy getting clean. Of course, you want to provide privacy as much as possible. So if you have a drape or a sheet or bath blankets, you want to drape it over. Okay, you're also making a bath mitt, changing the bath mitt to a new area, cleaning front to bottom. Okay, rolling them over, same thing, front, back. Pericare for a male, if they're uncircumcised, you're retracting all of that foreskin and cleaning from the center all the way out in larger circles. Okay, switching also the bath mitt to a clean area of your washcloth each time, or your disposable rag. After that, you would clean the foreskin underneath, and then the penis, and then the shaft. Okay, and then the ball area, and making sure to clean under their thighs. You want to make sure they're clean, dry, and intact at all times so they don't have any skin breakdown. Other skills that health center is going to cover. First, hand care and foot care. We will go over foot care in lab. Just remember to always verify where you're working, what kind of care they would like to be provided. But there are all the basics, like soaking it for 20 minutes, making sure that you get all the dirt from underneath their nails with the orange stick, and washing their feet from the dirty to the clean. If you're doing their hair, remember there's different ways we can clean their hair. They can have a bed shampoo done. They also maybe are in the shower or in the bathtub. Okay, so make sure that you're cleaning their hair daily and providing a brush, a comb, maybe braiding it, whatever they would like to do. You don't want to take them down to the dining room or to another patient's room with their hair all crazy. Also, part of the hair is facial hair with men. You want to make sure that their hair is shaved and they look appropriate. If they are using a disposable razor, some facilities still use these. However, I know in Castle Rock and Greenville we don't. Make sure that you're disposing those razors in the sharps container, and that's what the sharps container looks like right there. And most facilities, like I said, do use electric razors. Make sure you know how to use that before shaving the person. The next skill they're going to go over is oral and denture care, and they're just going to show you how to brush completely and how to inspect the areas in the mouth. Just want to point out, when you are doing this ahead of the bed, if they're brushing in bed, that it's all the way up the head of the bed is, and that you're using standard precautions. It is done twice a day, just like normal. If you're at home, you're brushing in the morning, brushing in the evening, and PRN when needed. Making sure to report any changes during any of these skills to the nurse. So maybe you saw a lesion, or maybe a small red spot on their foot, maybe on their hand, you notice there's some food underneath their nails, crusty from like days and days ago. So different circumstances with different patients. Some more skills they're going to go through is dressing and undressing. Allow your residents, patients, to make choices for themselves. Don't just tell them what they're going to be doing and what they're going to wear. Encourage them to do as much of it as possible. Help when needed. Remember to dress the weak side first and undress the strong side first. Okay, so just make note of that. When given a bath, you will be using a bath mitt during those procedures. You want to encourage them again. Let them do as much as possible. Develop trust with them, because it is a private and they might feel uncomfortable. So provide privacy and dignity when you're doing this. Make sure you're always during foot care, nail care, whenever you have a basin or a bathtub full of water, that you're checking the temperature, and it should be 105 degrees Fahrenheit. Then I just listed the types of bath, which are a complete bed bath, partial bed bath, a tub bath, a whirlpool bath, or a shower. I just want you to be familiar with those names, so when you see it in Health Center 21. The other skill is putting on eyeglasses and hearing aids. When you are applying both of those to the resident or patient, make sure that they are clean. I've seen so many times where the glasses aren't even wiped and you can't even see because of the film on it. Take a moment, clean the glasses, okay? Make sure that they fit correctly. And if you are leaving them at their bedside, make sure that they are within reach. If it's a hearing aid you're putting in their ear, make sure how to use it and how to put it in. make sure the battery is working, adjust the volume if needed, handle all of these devices with care because they are expensive and hard to replace. And you'll see more information on these skills in Health Center 21. Continuing our skills, again, like I said, there's a large portion in this module. So AM care, PM care, and pain management. AM care, I just did a quick list of what would be considered an AM care task, and that's done in the morning before the person's woke up and taken down to the dining room or served breakfast. So if you're maybe working in the hospital, you would do this before they get their tray in the morning. PM care is stuff you do in the evening. So again, it's stuff, maybe they're taking a nap and you need to waken them up and take them and get them bathed. Maybe they prefer their baths in the evening. So just make sure that you're doing what tasks should be done in the appropriate time. Okay? Pain management. It's not just asking them or if they're in pain. This is also watching their body language, watching for their facial movements to change. Maybe they're crying, maybe they're moaning. Some people, when they're in pain, are agitated or irritable. Maybe they're grouchy. You're making note of all of that, asking questions along the way, reporting that to the nurse. If it is part of your job description, you're going to be using pain scales and asking that patient what, on the scale of 0 to 10, 10 being the worst pain imaginable. Usually death occurs at this level, and 0 being no pain at all. Where do they lie? It is way easier sometimes to show a person this than explaining that. If the nurse, after you report to the nurse about the pain and she would like you to do something, as long as it's in your job description and under your what you're allowed to do, then you can try and do that to help relieve some of that pain. A lot of times warm blankets help, back rubs, lotion on their feet if they're not diabetic, or in between their toes you don't want to mess with. Also, I don't know, what makes you happy? Sometimes even giving them a nice warm cup of coffee or iced tea. So whatever you think that they might help them have their pain relieved. I did go over these really quick. I know it seems like a long video, but there was a lot to cover. Most of these skills, again, we will be going over in lab. If you want to practice them before lab, please do. Feel comfortable with the procedure. It makes your life easier when you do get to lab. We do change a little bit, but not very much. For you need to start memorizing these skills and the way they are laid out. So make flashcards. If you want, there is our skill checklists under Blackboard, under your lab tab. So if you go under that lab, under course information, you can print out our skill checklist. You do not need to print out the Health Center 21 checklists at this time for us. Again, if you want to use them for your own knowledge, you can. And if you have any questions at all, please contact your instructor and ask her. Thank you so much for your time. Enjoy the rest of your day.